All right, hello everyone. Welcome to our winter vaccinations webinar. My name is Fumi Worrell. I'm the interim service lead for health protection at the Birmingham City Council Public Health team. And today we're going to give you a session on winter vaccinations. I did want to start by just touching on measles and MMR vaccination. So obviously you're expecting a winter vaccinations webinar, but this is kind of hot off the press and just to talk about what's going on with measles at the moment in Birmingham and to encourage people to get their measles or MMR vaccination. So measles is a highly infectious disease which can be very serious if you get it. There's been a recent rise in measles cases across the country, and there have been outbreaks in London, in Stoke, and in Wales. There's been a recent rise of measles in close proximity to Birmingham, so we are at risk of getting an outbreak. 2 doses of the MMR vaccine are needed to get the best protection from getting measles. And unfortunately, Birmingham has a low MMR vaccination rate, and therefore that's why we're at the risk of an outbreak this winter. And so children and adults should catch up on any missed vaccinations by contacting their GP practice. And when you do, your practice can help you to make sure that you're up to date with all of your vaccinations. So I just wanted to touch on that and say that there's going to be more information coming out on MMR and measles this winter. So please catch up on all your vaccinations and contact your GP practice because vaccination can save lives and can help protect people from ill health and hospitalization. I'm now going to hand over to my colleague, Helen, who is going to give the rest of the presentation. Thank you, Helen.
Great, thank you, Fumi. So Fumi's covered off the sort of top bit of the agenda there. And so for the rest of the presentation, we're going to cover the history of vaccinations and then explain what vaccinations are and how they work. We're then going to go through the vaccinations, which will help you protect yourself, your family and your community this winter, who's eligible to get these vaccinations and how you can get them. And then finally, we'll briefly talk about children's vaccinations and using this winter as an opportunity to make sure your children are up to date with their vaccinations. So as mentioned on the title slide, this presentation is part of the Bolder, Healthier Winter series of webinars, the aim being to provide practical resources, in this case about winter vaccinations, to enable citizens and community leaders with direct reach to friends and family and an established trusted relationship to support their communities to improve overall health and well-being. So we speak a lot about the vaccinations that you need now and why they're important, but there's actually a long history of vaccinations in the UK, dating all the way back to the 1700s, when the first vaccine protecting against smallpox was developed by Edward Jenner. Since then, vaccines have been developed to protect the population against serious diseases such as polio, measles, meningitis, and the flu, with more recent developments leading to vaccinations protecting against diseases such as HPV and COVID-19. So, how do these vaccinations work? Vaccinations work by training your body to defend you against different diseases. Vaccines will contain a weakened or inactive form of disease, or they'll contain a blueprint for a disease. So when you get a vaccine, it tells your body to create antibodies, which fight off disease. Your immune system remembers these antibodies, which means that if you come into contact with the disease later on, your body already knows how to fight it, which can protect you against that disease. So every year, the NHS offers free vaccinations to help protect you during the winter. And this is because viruses such as COVID-19 and flu circulate widely during the winter. Winter vaccines are offered to those most at risk from serious illness and help prepare those people for the winter period. And you can find out more information on why vaccination is safe and important by clicking the link on this slide. So one of the winter vaccinations is the flu vaccine, which we all know is common during the winter. Flu is spread through droplets that are released when an infected person coughs or sneezes. And the best time to get your flu vaccine is right now in the autumn, so you can protect yourself before flu starts spreading this winter. But they are offered throughout the rest of the winter season. So, as mentioned before, you're going to be eligible for a free flu vaccine if you're at increased risk of becoming seriously unwell from flu this winter. You're eligible if you're 65 and over, have certain health conditions, if you're pregnant or in long stay residential care, if you're a carer, or if you live with someone who's more likely to get a severe infection due to a weakened immune system. So some children are eligible for the flu vaccine as well, including those who have long-term health conditions, 2 and 3-year-olds, primary school children, and secondary school children up to year 11. Most children will receive a nasal spray, but some children will be offered an injection if it's more suitable for them. So if you're eligible, you can contact your GP surgery to book an appointment. You can book an appointment with your local pharmacy or book online or through the NHS app. You can also call 119 if you can't get online. And remember, you don't have to wait to receive an invite to go ahead and get your flu vaccine booked in. So the other winter vaccine we're talking about today is the seasonal COVID-19 vaccine. Again, I'm sure we're all very familiar with COVID-19 by now, but as a refresher, it's an infectious disease caused by the SARS-CoV-2 virus. And this is spread when someone with the virus breathes, speaks, coughs, or sneezes, releasing small droplets containing the virus. And those who are at increased risk of getting seriously ill from COVID-19 are eligible for the seasonal COVID-19 vaccine this winter. So you can get the free seasonal COVID-19 vaccine if you're 65 years or over, have certain health conditions, live in an older adults care home, are a frontline health or social care worker, are a carer, or if you live with someone with a weakened immune system. Children aged 6 months to 4 years old can get a first and second COVID vaccine through their GP surgery if they are at increased risk of getting seriously ill from COVID-19. So if you're eligible, you can book a COVID-19 vaccination appointment online or through the NHS app. You can find a walk-in COVID-19 vaccination site, or you can call 119 if you can't get online. So it's also important to use this winter as an opportunity to make sure your children are up to date with their vaccinations. As Fumi mentioned, 2 doses of the MMR vaccine is the best protection against measles, and the MMR vaccine is just one of the NHS vaccines that children are eligible for. So the link on this slide will take you to the NHS vaccination schedule, where you'll be able to see the full list of vaccinations children are eligible for, starting from 8 weeks of age all the way up to 14 years of age, protecting your child against diseases such as meningitis, rotavirus, and tetanus. If you think your child has missed one or more of these vaccinations, then please make sure to contact your GP surgery. So, in summary, it's really important to make sure you get your COVID-19 and flu vaccinations if you're eligible, and this will ensure you have the best protection against serious illness this winter. And make sure to check the NHS routine vaccination schedule to ensure that your children are up to date with their vaccinations as well.
Thank you, Helen.